Medical stress and trauma. What are some real practical tools available to support doctors and other healthcare workers? If you're a doctor, healthcare leader, or patient, you belong here. I'm Kim Downey, and this is Stand Up for Doctors Conversations at the Intersection of Connection, Courage, and the Future of Healthcare. This episode is sponsored by Brian Case and Direct Wealth Care, providing conflict free tools and resources that help physicians address the financial stress not talked about in medicine. And today I would like to welcome Dr. Matthew Mullane and Christen Mullane. Thanks for joining us today, Matthew and Christen.
Thanks for having us, Kim.
Thank you.
Good to
You're
be here.
you're you're welcome. It's great to see you. So, Kristen, I met at the Dr. Lorna Breen event over a year ago, and we had planned this back then. So I'm glad that we're finally able to have this conversation. And by way of brief introduction, Dr. Matthew Mullane is a board certified in family medicine, integrative medicine, and addiction medicine, and he's the creator of Ritual Medical. And Dr. Christen Mullane is a psychologist, writer, and human who cares about making healthcare healing, and she's the creator of Ginkgo Leaf Health Services. And I would like to ask you what you'd most like our audience to know about you as we begin our conversation. Kristen, would you like to go first?
Sure. I've worked in healthcare my entire career, all around the country. And over the course of that journey, I've seen really similar pain points in a lot of different places and a lot of different hospital systems. So I've worked in places like palliative care, cancer clinics, primary care, and ERs. And so I'm looking forward to talking with you about those experiences today and how they informed my writing. And also, my relationship with my brother and ability to I empathize with what he has gone through in medicine.
Yes, for sure. Thank you for sharing that. And Matt, what would you like to share?
I am a re recovering physician, I guess. Um, I think about some of the stress and burnout that I've experienced in my career. I'm happy to talk about it. I love being a doctor. I really do.
Mhm.
And I've never had so much doubt about my career choice than I have more recently in this sort of third round of burnout where I'm sort of slapping myself a bit for like I just did it again, you know? And I feel every round you get smarter and wiser, but I really love my work and I really love bringing more focus to the topic of medical stress and trauma because I've lived it. It's affected me, my relationships, my wellness, and we need to do a better job here. You know, we are healers, and you can't really heal from a position of or from a work culture that's rather, traumatizing and highly stressful. There's no way around some of the stress, but we can certainly do a better job with our culture.
Mhm.
Right, absolutely. And I understand all of that deeply. And thank you both for being willing to share your stories. And I say so many times that every time a doctor shares their story, another doctor feels less alone. So it's important because so many doctors walk around saying, I thought it was just me, or I thought I was the only one. And it's not. So when you each share this story, it adds to the collective. But of course, the problem is it shouldn't be like this, right? Like you are healers, you got into medicine to help people, and we have to learn how to make things better because we need doctors. We can't have all these doctors leaving, so we need systems and med schools. Like everyone needs to do a better job of supporting those who are going to be healing others. So thank you very much. And who would I'll let you guys decide who would like to go first to share a powerful story with us.
Dun dun dun. Shall we start?
Sure, yeah.
Okay. I think well, one powerful story that's actually happening right now. We're joining you from new parenting land. And so I think
Congratulations.
Thank you.
yeah, I think it's been really, really powerful to watch Matt begin to balance career and parenting. And so that's our current events and current place we're speaking to you from. But in terms of my own journey, I think one of the most powerful moments for me happened when I was working in a hospital system And I'll share this story in a way that's not too triggering for listeners, but this was one of the hardest moments for me to move through in my career. This happened against the backdrop of the pandemic. So right before we were in the really acute throes of the COVID-19 pandemic, I worked in a hospital where a patient came in to the hospital and committed suicide.
Mhm.
And so, what that did to the medical community, how people responded, how the entire hospital system was impacted, was really striking. After that event, people grieved. Our community of providers was pretty traumatized, right? And then we also had a lot of turnover after that, up and down the chain of command, um, as you might expect, because that was a really difficult event to manage. And then there was a lot of scrutiny, a lot of scrutiny. And I think that's one of the things that woke me up just to how impactful negative events can be, and how when a hospital responds from a place of punitive culture or shaming culture, it really contributes to ongoing wounding instead of helping the community come together and heal. So there's just a lot of different places where I think leadership in hospital systems can do better. And I think where we as providers can step towards one another and hopefully even help patients understand some of the things we bear witness to as providers, not from a place of needing to be rescued, but from really a place of being understood and witnessed, because that's where healing comes from, in my view. Like having our perspective held with compassion is incredibly important. So that's where I'm coming from. It's from that place that I launched my practice. It's from that place that I wrote this book. It's just
Yeah,
seeing
well,
how our community dealt with that.
right. Well, thank you because as you know, I'm doing this work because my own doctor, died by suicide and
Mm.
I thought I would never go back there. It was a standalone building. But a couple years later, I found myself I needed further imaging and that the doctor who was seeing me wanted me to go there. And when I went to your point about all the turnover,
Mhm.
nobody was there that was there when that happened because I was hoping to see the technician because she was so kind that
Yeah.
day and she had moved out of state. And I know that they didn't they didn't close the place. So the people who worked most closely with my doctor couldn't even go to the funeral or anything, which I feel is a big mistake.
Mhm.
So like I understand the impact, and that's what brought me to be doing this work is similar with you. So thank you very much for sharing that. And Matt, you mentioned, and I'm sorry that it has happened again, that you're in your third round of burnout. And some doctors have told me that it can look if they've had more than one episode of burnout, that sometimes it's more physical symptoms, sometimes it's more emotional symptoms. So at first, even once they experienced burnout, the second time at first they didn't recognize it again even in themselves because it manifested differently. And I do want to say that I know a lot of doctors don't like the word burnout because they think it's moral injury. And if you use the word burnout, it almost places quote unquote like blame on the or responsibility on the individual when it's a systemic issue. So I feel like I understand the difference between burnout and moral injury, and you can have either or both. But like resilience means going through a challenging time and coming out stronger. So while we're trying to figure out how to change the system, that there still are things that individual physicians and healthcare workers can do to shore themselves up. And I think that speaks to your book here, Kristen, right?
Yeah.
So what would you like to share, Matt?
Um, so much. I
Yeah.
was just thinking of all these that you could call them buzzwords, but you mentioned a few: burnout, moral injury,
Mhm.
resiliency. Some of the factors that led to episodes of burnout for me. I suppose like one of the hardest decisions I made as a result of feeling burnt out was leaving my primary care job.
Mhm.
I left it to I mean, people might call me crazy to do this, but I left it to work in a addiction medicine detox center. Um, and that's when I got board certified in addiction medicine. My theory at that point was maybe I'm just not cut out for primary care. So if I work as a specialist, at least the cases are sort of channeled into that specialty and contained. And addiction's a really special field, where you're really, especially in detox and residential treatment, you're working with people at this really vulnerable point of change and initiation of recovery. So you can not always, but sometimes you can really see a transformation and help people at that vulnerable place. So that was the theory, but leaving primary care, I felt all sorts of things. I felt embarrassed. I felt shame. And I was like, come on, I should be strong enough to do this. Why do I care so much about my patients? And why do I experience so much moral injury with the system? And is it just that I'm a sensitive guy? And I am. you
Mhm.
know. Another thing I think about is moral distress and ethical conflict. And those are big factors that come to me, or, that I think about contributing to burnout.
Mhm.
Biggest example there is I became a doctor when we were just starting to acknowledge the opioid epidemic. And one of my first tasks as a doc was inheriting an older docs panel where so many patients were on polypharmacy that included controlled substances, benzos and opioids.
Mhm.
And that doc retired, and it became my job to initiate safe prescribing practices. Um, which doesn't mean cut off those controlled substances, by the way. It just means safe prescribing. You know, um, so that was a ton of work. And I think that plus like a feeling of leadership that was detached from the boots on the ground, so to speak, um, and detached from like the emotional stress that a lot of us, primary care providers were feeling. Um, at any rate, just led me to say, all right, this job's not for me, I guess. Right? And then I look back and I say, it sure as heck is for me. I'm a great primary care doc. I just was practicing within an environment that where it was an impossible situation.
Yeah, can I
Yeah,
pipe in there? Because
please.
Kim, you're talking about different concepts that I see as being highly related. And so if I can articulate a cycle that I've seen in my practice, and I have the privilege of working with healthcare workers in therapy, which is a rare thing. People don't always seek therapy when they're identified with being a rescuer. They're being the one who gives help instead of receiving it. And also, I've had folks work through a cycle with me. And the way I see it is that first, there's some kind of systemic failure. There's short staffing, there's rationing, there's scarcity, and physicians and nursing staff, healthcare workers are operating against that backdrop of scarcity. And so, what that means is that errors and mistakes are more likely to happen.
Right.
And when that happens, then there's some kind of a moral injury because no healer goes into medicine saying, like, I want to harm somebody, right? But there are some unavoidable mistakes that happen when we're operating in a difficult system. And so, moral injury is this idea that our core values and beliefs have been violated in some way. And one of the beliefs in medicine is first do no harm, right? So there's inherent in in medical culture, there's this idea that we cannot make mistakes. It's actually really similar with military culture. This idea that we have to be perfect because the stakes are high.
And I would just add to that, it's
Yeah.
kind of a hypervigilance to
Mhm.
not make a mistake, which is,
Right.
exhausting.
Right.
And it's kind of, our father was a fighter pilot in the Marines
Mhm.
for a period of his early career. And, um, you know, kind of relate in a way. I think it's difficult for people in these performing, like high stress, hyper vigilant positions. One, it's already difficult to admit or share vulnerability, and two, the culture really doesn't welcome it.
Right.
Mm-hmm.
It's still, no matter how much we've tried to tuck in, like, oh, let's do wellness and let's do work-life balance and mindfulness. it's still like behind the scenes. There's in some cases there for some providers there's this current of, well, you're weak,
Hmm.
you know.
Hmm.
You couldn't cut it. I used to see 60 a day, you know, or and I'm like, that's not the goal. Why are we so sick still? Why is there so much chronic illness if we were doing a good job?
Yeah.
Right, right.
Yeah, so there's the cultural pieces that then say like whatever shame we're feeling as the high achiever in this job is confirmed by the culture outside of us.
Hmm.
And then, in my view, burnout stems from that because in reaction to our perceived mistakes and shame, what I see are behavioral overcorrections, one way or another.
Hmm.
One is to really lean into perfectionism and say, I'm going to be the best damn doctor, sorry for my words, but that you've ever seen.
I'm not going to have a malpractice lawsuit, which I never have.
Hmm. Yeah,
Um,
Right.
yeah.
but part of that's because of this unhealthy thing where I'm like, I'm leaning in,
Yeah,
and
Hmm.
then I lean totally out. It was
that's the
very
other
like,
one. That's the
yeah,
other
I did
overcorrection.
both.
Yeah.
Yeah.
I overcorrected both ways, and I can look back and see that now in this, third round of maybe like welcome. I don't know, it was burnout sort of, but I'm a new dad. I'm burning out in a different way right now.
Yeah.
Um, Actually, you don't burn out as a dad. I should take that back.
Mhm.
There is something about having a child as a side branch that to me is so infinitely rewarding that no matter how stressful sleep regressions and crying and everything else can be, you get a smile and a giggle, and it is just like it's infinitely rewarding. Um,
Yes.
Yeah,
at any rate, and ideally, work would be that way too.
it's really
You know,
rewarding, so it's protective, right? And I actually
right?
think that's why burnout sneaks up on people a lot of the time, is that we're doing really values congruent work. And so the exhaustion, which is that first kind of sign or signal that something's wrong, like we push through. And there's so much within medical culture that encourages that pushing through your body's signals in order to accomplish a mission,
Right.
right? So the symptoms of burnout, if we're really looking at them, are disengagement, which is an adaptive response when systems are harmful.
Hmm.
There's cynicism, which again is a protector. It protects us from our own grief, from our own disillusionment. It's a way of trying to look at systems realistically from a really sober lens. And then from those places, though, then we get a feeling of professional inefficacy. And that I think reinforces a lot of the burnout and a lot of the moral injury because when healthcare workers see themselves disengage and become cynical, it leans into that whole space all over again. Like we re-wound ourselves. I
Hmm.
should be ethical. I should be a better doctor. Like all those shoulds.
Right.
It started up all over again.
Yeah, they do. It makes me think a little bit about, I think for many people, no matter what career you're in, it's a part of your identity. For healthcare and other like really nurturing careers, it can swallow you up, so it becomes a very high percentage of your identity. You can get lost in that, and when that identity starts to crumble, due to this sort of moral injury, ethical dilemmas, and burnout cycles. I think coming back to the lean, you lean in, but eventually I think that breaks. Either all
Mhm.
your relationships break because you're leaning in so hard that you're not giving time to any other value, and then it'll crumble,
Hmm.
or you lean all the way out, and that's when we get into that. What we were talking about earlier with the high rate of depression and the physician suicide rate. Um, And I want to speak to that just for a moment too. I don't speak for every doc, but I do know that about one-third of all family docs are experiencing or have experienced depression related to their job, or I've at least seen that stat. Somebody fact check me out there. And I'm one of those, and I want to be open about that. We treat depression. Depression is a fairly common experience, and the more we are able to talk about all of our experiences with that and how we move through it, I think the better for everyone. Um, but yeah, when I was depressed, trying to again, I don't know the audience, so I'm trying to mark how I or
Mhm.
tread carefully through this conversation. But I felt a dead end. I felt trapped by medical debt, my student debt. I was in public service loan forgiveness, and I was like, I got one more year and I'm down. I left primary care. I'm barely making it through this addiction medicine detox job. I don't know if this career is right for me. I have 1 year left, or else I got to settle that 250K of debt, which is less than a lot of other docs out there, by the way. Um, so I just felt so trapped, and I think all of that contributed, to a really difficult period. But yeah, I guess I didn't mean to take too much from what you were
No,
saying there.
like this is, I think I definitely hear people talk about this with me, and I do think there's a grieving process that happens when we move from the idealistic kind of place that many people join medicine from into the reality of what it's like to, have to talk to the insurance company more than your patient, or, like some of those places that are pain points for so many healthcare workers. And we don't have a lot of research at this point that I'm aware of around who joins medicine, like who seeks these careers. We do have some about who joins the military, and I'm just wondering what the overlap might be, because often in the military we have people with pro-military values who've come from family systems where that's been part of the culture, or people who are trying to exit a hard path, like a hard life. And I do think people get drawn to medicine for similar reasons. Like they come from families where there's a lot of high achieving, a lot of physicians already in the family system, or they're coming at it from a sense of like, okay, I can work through nursing school, I can get my paramedic certification, and that brings you into the healthcare orbit and maybe away from some hard things. Like you want to be part of the difference, part of what makes the world a better place.
Oh yeah.
And that high achieving, I mean, that comes at such a cost. It's hard to lean out if all the things that have helped you in life have been like, I'm an excellent problem solver and I make an A on all my tests.
It's that identity again.
Yeah.
If you've formed all of your identity on the pursuit of excellence, you're a striver, and you're going to keep striving until you learn a core mindfulness lesson about non-striving and letting go.
Yeah. And that's a grieving spot. Letting go is all about grieving identity, grieving the things that used to serve us in some way or work for us, the strategies that no longer work in this context, and trying to come up with more acceptance-based coping, which is difficult. It's difficult.
Right.
Yeah.
Well, it is. It's so important to be shedding light on all the things that you're talking about. And I have heard, anecdotal stories from physicians that, again, to your point, that some the parents were high achievers, or even culturally, you're going to be a doctor. You're going to be the doctor in the family, or that they had traumatic experiences or the high ACEs scores, and they want to help other people. So there's anecdotally, I've heard all those stories. I don't know specifically as far as studies that show who goes into medicine, but I like that you point out that there's systemic failures, that lead to the moral injury. So I think acknowledging that is really important. And so I know in your book you share some real practical tools available to support doctors and other healthcare workers. What would you like to share?
Sure. Do you have any thoughts before I share?
No, I want you to share. I'm really proud of you.
Um, so one of the things that I talk about in the book is it's actually a framework that was developed, back in the days when psychologists used fairy tales in order to help people, have a framework to hang their experience on. And so from that work, like if you think about the fairy tale of Little Red Riding Hood, the thing that drives the plot is this idea that there's a victim, there's a perpetrator, and there's a rescuer. So we call that the Cartman drama triangle because it drives some drama. And we can really internalize a particular role on that triangle. And so when we were talking earlier about being identified with the rescuer, most people want to be that, especially when they're joining healthcare as a community, of people who heal. And so one trick I think is to get away from that triangle entirely and to really begin to look first at the ways in which we might do harm or be hurt. And when we're really, really pigeonholing ourselves in one identity, it's hard to recognize that we're hurting, it's hard to also recognize, even though medicine has ethics, and I think we try to recognize where we do harm and to mitigate that. I think we need to be able to step into that place and take a little bit of accountability and not be fragile in our places of shame. So some kind of shame resilience. And so maybe step one is just awareness that like, hey, okay, I don't want to be the bad guy, but sometimes I might lean into this place a little bit, or I don't want to be the one who's hurt, but sometimes I'm hurting. And then I come from a place and space where the field of psychology, we've got these third wave therapies like acceptance and commitment therapy or dialectical behavior therapy that use a lot of mindfulness skills in order to help people cope. One example is radical acceptance. And so I touch on this just a little bit in the book, but the idea of radical acceptance is to be able to say, like, one practice is to say, all decisions have led up to now. And we're not just talking about our own. Medicine it's an interaction between legal systems and government systems, and then the medical system itself, educational systems. Like, there's so many people making decisions that have contributed to medical culture as it is. So we don't need to own the entire thing. We can just take a breath and say, okay, what do I actually have control over here? And so some of the things that I do talk about in the book are taking care of sleep. There's actually a form of therapy called cognitive behavioral therapy for insomnia that can be really helpful. And so when we have taken care of our pillars of health, sleep, nutrition, physical activity, that's a place and space where I think we heal. And also, as you're becoming aware of burnout symptoms, framing them as things that are protectors instead of a problem to be solved, helps people step back and say, all right, if I'm disengaging, can I do that mindfully? Can I do that with choice? When and how do I need to disengage in a healthy way? And what does that look like for me? So that might be things like journaling or getting out of work on time, setting boundaries with our environment. So there's some communication skills in the book, like a BIF response, like a boundary setting strategy, which is like to just be brief, informative, friendly, and firm. Just say the thing you need. So there's, different places where I think the book can be helpful. And then just having so much self-compassion where you're at.
I smiled a little bit as Kristen was talking toward the end there because I was like imagining self-care in that primary care gig that I had. I was at a FQHC, and it honestly is a wonderful FQHC. It was really, you do they were doing about as good as you can do with the funding that they get, and primarily Medicaid, uninsured, high mental health, high addiction population. And I'm like, sleep, yeah, right. Exercise, good luck. I'll go 15-minute walk, but then I'll miss lunch, or I'll eat while I walk, while I chart, I think we're living in a really interesting era of AI and medicine. I have to speak to this because I really don't like that it's going to come down to us learning how to use AI tools to restore wellness and work-life balance for physicians, but at least there's that coming along. And where currently in primary care, for every hour of direct patient care, you have 1 to 2 hours of administrative tasks and EHR documentation to do. You're spending more time with your computer than you are with your patients. We know this. I think AI is a game changer. The problem is it's taking the focus off of what we really need to focus on still, is our system is sick.
Yeah.
And our providers are sick, a lot of them. And maybe AI, just like a lot of other tools, can help make it a little bit better, or maybe a lot better over time. Or maybe it'll put half of us out of work. I don't know. And then what? But the point is, we have this system here, and we are allowing it.
Yeah.
Right.
So much of the work is not something you can do as an individual, and that's where I think that radical acceptance or grieving idea comes in. Like it's going to take a lot of advocacy work and people really identifying what a healthy culture in medicine would actually look like, and letting go of that idea that if you can't hack it and push through, you're weak
Right.
in some way. That's not helping
Yeah.
anyone. It's
No,
actually increasing medical errors and risk for that.
you got it. If you're charting, what's pajama time charting,
Right.
late night charting to be caught up so that you're leaning in that situation so that you're not going to have any holes in your documentation, no chance for lawsuit, good patient care, da 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 da. Right. I don't know that.
It's hard to let it fall apart.
Yeah.
Both because the system is reinforcing some of the things that high achievers naturally do,
Mm.
and now there's the legal ramifications if you let things fall apart. But there can be such information in the falling apart. Like when
Hmm.
any high achiever person decides to they really can become load bearing, you
Right.
know? And so when they decide to step out of a role, things really can fall apart.
Yeah.
So that's a lived experience that so many providers have, and there can be such information in letting it crumble.
Right. And I do think, on the administrative side, there's only so many replacements you can find and train
Mhm.
up and afford to train up and into that same really emotionally destructive role.
Mhm.
Before you've got to realize too, like you got to take your work, your wellness or whatever you want to call it, work-life culture seriously for your care providers.
Mhm.
Right,
We can't,
absolutely. Yeah.
yeah.
And also, patients need to care. And that's what I have to figure out how to raise better
Yeah.
awareness. Because if we're going to change things, right, once
Yeah.
they're there, we need to have a groundswell of patients that understand all of this. And speaking to radical acceptance, if people aren't familiar with the term, even me as a patient, I had a complication from my first cancer surgery that affects me every day for the rest of my life. And I did learn about radical acceptance, and I wasn't really moving forward until I had something I said in my own brain. It was something like, what happened, happened. There isn't anything I can do about it, but I have doctors that I can trust that'll help me through it. So, for
Mhm.
whatever it is for your situation, like learning about radical acceptance. So that's one part, but it doesn't mean you have to accept being in a toxic work environment, right? There's
That's
different
Exactly.
right.
things.
Yes.
And
Yeah.
also,
Yeah.
what you spoke about is what can you control? Because everyone has more control than they think they do. And just
Mhm.
figuring out how can you take that control, some of that control back. And also in the self-compassion, that is absolutely critical. So thank you both for sharing all of this. It's been such a great conversation, and I'd like to ask you each in one sentence, what is your take-home action message for our audience? Kristen?
I think my take home action message for any healthcare worker listening is not to be afraid to ask for help. We all need to be interdependent, and it's an illusion that is fed to us by our culture that we are independent. So, leaning into your people that you trust, building those networks if you don't have them already, maybe starting with a good counselor who understands medical culture.
Mhm.
Those are things that you can do to start to replenish your well. So that would be mine. Yeah.
Uh, my message may sound a little funny, but it's what I'm telling my daughter when I'm going through a sleep awakening, awakening during in
Yeah.
between sleep cycles. And it may not translate perfectly to all the providers and even the patients out there who are suffering or in pain or working through burnout. But I say, it's okay. I love you. It's time for bed.
Yeah.
And that's it. And just
I
say it.
love that. I think that's the perfect way to end this episode. So thank you so much. And thanks for being my guests again, Kristen and Matt.
Thank you,
All right.
Kim.
Thanks so much. Wonderful to meet you and to do this with you.
Yes, it's wonderful to meet you and to see you again, Kristen. And what I'd like to share with our audience is if today's conversation resonated with you, you'll find more stories like this in our White Coats book series. And for those who feel called to go deeper, we'll be gathering this October at our inaugural physician retreat and would be honored to have you join us. Links are in the show notes, including how to reach out to our guests. And please reach out if you're interested in sponsoring one or more episodes. It truly sustains this work. More information about sponsorship is also in the show notes. And in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients, patients need to care about doctors too. So stand up, doctors, and let's stand up for doctors.
All right.